The COVID-19 pandemic has resulted in misinformation and conspiracy theories about the scale of pandemic and the origin of prevention and treatment of the disease. False information has been spread through social media. And last year, a study published in the American Journal of Tropical Medicine and Hygiene also estimates that about 5,800 people were admitted to hospital as a result of false information on social media. A group of South African researchers have conducted a study looking into myths, misconceptions, and stigma regarding COVID-19. And to discuss this, we're joined by Adlai Davids, one of the research authors. Thank you so much for coming through.
Good afternoon, Colin. Thank you for having us and your interest in our research.
Yeah. Well, how did you do this research in as far as the methodology is concerned?
Well, basically, as the Human Sciences Research Council, when we had the initial lockdown at level 5, our CEO's office mandated a group of us under the guidance of Professor Priscilla Reddy to also look into the behavioral aspects of the pandemic. And what we then embarked on was to construct a qualitative research study, which the aim was to investigate South Africa's communities, the constructions of myths and misconceptions of, firstly, who is most vulnerable to contract COVID-19, as well as how these beliefs at times would actually also inform a discourse of stigmatization and othering. So for that, we had, it was lockdown, so we couldn't do any face-to-face interviews, which was a little bit of a limitation. But because telephonic interviews is pretty standard sometimes with qualitative research, we had about 60 key informants all over, 3 provinces, as well as one focus group we conducted with carers in an old age facility. So in essence, it's a qualitative study, and we've done it in 3 provinces.
So basically, what do people know about this virus in terms of how it can kill people? You remember the context has been that when this pandemic started, many South Africans didn't take it seriously. And there was so much flat-footedness in as far as being worried that anybody could contract it and they would die from it.
Yeah. Well, one of the misconceptions that we had was the prevalence of a natural immunity to the disease. And that we found in our research, mostly amongst young people, youth, whereby there is an assumption that there is a natural immunity and they would not need to take any of the precautions. Of course, because the study was done in April, what we do know now is that it has to do with the fact that many people are actually asymptomatic, even when they are COVID-19 infected, and then can actually transmit the disease, which is then symptomatic in much older and more vulnerable or people with underlying conditions. So what we found that natural immunity or existence thereof is was one of the myths and misconceptions that there were. And also, what this led to was the fact that many people did not adhere to any of the behavioral interventions that we had or what was suggested to combat this. For example, wearing masks, social distancing, and also sanitizing of hands regularly, as well as around cures that if you drink hot water, with certain other kinds of things, it might be a prevention. And why this became a myth or a misconception is that the research does tell us that if you drink a lot of water in general, one's systems might be far more geared towards any infection. It's not entirely preventative, but perhaps one's immune system can respond better. But it's not as preventative as might be in case. And one of the other ones that we found also that because myths about the nature of the testing kits that are going to be used can actually also result in people failing to test. And even if they do test positive, especially if they're asymptomatic, failure then to isolate and try and protect others in that way. So we found that is the kind of information. This it has some truth in it, but with the nature of myths and misconception, it's not based or based on scientific validation. And we see this also at the moment, even with our research then in April, already even in the absence of a vaccine being developed. Really, for example, vaccine hesitancy, people just waiting and see whether this vaccine will work for people who have taken it, to outright complete being an anti-vaxxer and saying, I don't believe in vaccines or in a COVID-19 vaccine at all. So in essence, these are the kinds of misconceptions that comes up, which points out that we need to do a lot of work in terms of communicating, and the Department of Health, I do think, has started to doing more work in the field of telling about COVID. It's good that we hear about the nature of the new strains that's available, with et cetera, et cetera. So those are the kinds of information that leads to it's like a half-truth that if you put it on social media, it expands and runs away from us and can lead to these misconceptions.
Yeah. So when it comes to issues that border between what could be factual and conspiracy theory, is the origin of COVID-19, that it was a lab-manufactured virus and it spiraled out of control, and the issues of the FBI, CIA and Chinese intelligence, and the whole thing blew up in Wuhan and it ended up spreading by mistake throughout the world. On the other hand, no, this is the virus that is meant to kill black people. Look at the infection rate in South Africa and people are dying. All these misconceptions that lead to also 5G exacerbating the infection rate and killing people when they have COVID-19. How do you dispel such a notion, and what is the truth?
Well, it's obvious. There's an adage that says the misinformation has been around halfway around the world, and while truth is still putting its shoes on. So what is happening is that all this, I think many of these things has been dispelled. For example, around 5G, for example, being spread. Even I saw a post today by the Department of Health that say it's impossible for a virus to spread via radio waves or via 5G networks. And sadly, we've seen even in South Africa, there's been destruction of 5G or mobile towers infrastructure, which is really sad. Obviously, that's devoid of truth. But what the relationship we had with that in terms of myths and misconceptions in our case was that at the beginning when we started, it was related only to say that more wealthier people, people who are able to travel abroad, and in the history of South Africa, that's been equated to being white, quote unquote, whereby that's a spread, and that it's more them, though people who meet that description are more vulnerable to the disease, which is, of course, we now know it's not the case. Everybody is vulnerable. The truth is, people have been at pains to discuss what is the truth and to debunk these myths and misconceptions. Your question as to what can be done is, especially now with vaccines, yes, we should watch the results and the research of the vaccines that are being, people that have been vaccinated in other countries and regions of the world, and see what the results are. We need to make sure that we engage any misinformation that's in there. With regard to vaccine hesitancy or the anti-vaxxers, I think it is very difficult to change people's minds.
For making
but
time,
we're dealing with a pandemic that, it's crazy. Yeah. So we just education and more awareness around specific things, and I think our research helped a little bit.
You know, Adlai, there's so much to talk about, especially with the question that I received that. What about the Chinese? Have they vaccinated and their numbers have dropped? But we will talk about this. We've run out of time. In the moment, I have to actually go to a colleague who's standing by so that we can take our stories further.